this week every week I look more and more into the NHS. I choose a block of the NHS and I start researching and trying to develop my knowledge on an area that I believe our country is failing. Health and the healthcare system are so important to the well-being of people, and I want myself and my family and my country to get the best healthcare that the country can afford. But at the same time, I also don't believe that throwing loads of money at an industry that's failing is going to solve a problem. I think it's really important for us to identify the problems within the NHS, problems within the system, and then design a system that is better suited to the way the country is and the way the country's going. Now, I found a very interesting article, and it was a study by a group of research students, and they were talking about 40% of all GP appointments in England consist of frequent attenders. So 40% of all appointments are around 10% of the people that attend the doctor. That is a scary number. And the fact that we got an aging population and we're getting more and more people getting sick and more people on antidepressants, more and more people living with pain than we had 10 years ago, you start to think, where are we going wrong? If we're in a world where we have increased access to high quality food, we have increased access to the understanding of health and well-being, we have increased health and safety and increased workers' rights and increased lifestyle, increased luxuries, yet we're still unhealthier than we were 10 years ago, then there's a serious problem that we need to get down to the bottom of. And we need to start figuring out why people are getting sick, and why people are staying sick, and why people are going to the doctors as much as they are. So here's a bit of data that I pulled up this week. And basically it is frequent attenders now make up to 40% of appointments in England. The UK average of visits to the doctor per year is 7 times a year, whereas countries like America are only 4 times a year. Now, I went onto the Bupa website and I got a cost for a private doctor's consultation. And the cost for a private doctor's consultation is around £75 per 15 minutes. Now, if the average person went to a doctor 7 times a year, and the population of the country is 68 million, that would equate to the total visits to the doctor a year of 481 million visits to the doctor, which would come to a cost of 36 billion just in visiting your GP. Now, if we reduce that 7 to 4, even on the £75 Bupa rate, we would drop to around 275 million appointments, and that would cost the country 20 billion, which is a net saving of 15 billion a year, just by reducing the amount of visits from a doctor to 7 to 4. Now, let's say, for argument's sake, every doctor in the country was private, just for argument's sake, and the government had a scheme where they paid the doctors privately to see their patients, but the doctors didn't get a set wage for how many patients they have. They only got paid by the patients that came and saw them. So if they weren't giving enough appointments, they weren't making enough money. Let's say we got the cost of a GP appointment down to £50 per appointment, and we still did 7 appointments a year. We never improved the health of the population, we just controlled the cost. That would result in a £24 billion a year bill. Now imagine we drop it down to 4 visits a year at £50. That brings it down to 13 billion, which, if we compare it to where it is and where it could be, that's another 10 billion saved. So essentially we could be saving around 23 billion just in the fact of getting people down to 4 visits a year on average. Obviously you'll always have more, and controlling the amount people can go to the doctor. Now, I grew up in Africa, and we had private healthcare in Africa, and it was very good healthcare, but yes, it does cost money. If you look up something like Discovery Health, for example, they charge like something like 6,000 Rand a year, and they give you a full comprehensive medical package, where you can go to the doctor so many times, you can go to the dentist so many times, you go to the optometrist so many times, you can go to the hospital when you need to go to the hospital, you have your chronic medicine, you have your medication, you have all these things as part of your package. What if we change the NHS from a national health service to a national health scheme, and we privatised the NHS? And everybody in the country got a national health scheme, and they got this like medical account where we got so many visits to the doctor a year to a value of X, so many visits to the optometrist a year to the value of X, and if you didn't use it, it carried over. So let's say you're an incredibly healthy person like myself, you never go to the doctor, you're incredibly healthy, you could build up your medical savings to a huge sum of money by the time you get to retirement age. And with that money that you've saved in that pot for retirement age, that would look after you through your retirement years. I wonder if we had a look at restructuring the National Health Service, if that would make more sense to the way we spend the money in the NHS. What do you think about that? What are your thoughts on that? Because if we, as a nation, had a national sponsored health scheme that paid our private doctors, and our private doctors were all ultra efficient because they want to make as much money as they can. The prices are semi-controlled because it's government as the customer, but people manage their own budgets. So healthy people that look after themselves, they have a really healthy budget for when life hits you and you do develop cancer or you do develop a disease or something that's unplanned for. But for the people that don't look after themselves, the people that don't look after their bodies, and the people that deteriorate over the years, they won't be able to just go to the doctor unlimited. Going to the doctor unlimited is what allows people to not take any responsibility in their life. Now, I'm not saying there shouldn't be a safety balance for people who are in bad health. I'm not saying that we should turn our backs on them. What I'm saying is there should be some sort of a check and balance to reduce the amount that people go to the doctors unnecessarily, or increase the amount of check and balance where people take ownership of their health because they know they don't have an unlimited amount of money they could just go spend at the NHS. I wonder if this would make life better for us. I wonder if this would change the way the National Health Service runs, and I wonder if it would actually reduce the costs. Like all government institutions, people tend to work very hard, but they don't tend to focus in the areas that need to be improved upon. And I think when you're operating a business that's really focused on making a profit and needs to make a profit in order to survive, things become a lot more efficient. Doctors' surgeries will become a lot more efficient. They'll develop ways where they can assist customers without having the actual GP, which will reduce costs. They'll figure out ways, but they'll do what they can to keep their business models profitable. But at the same time, if a customer is not happy with the service they're getting, they'll go somewhere else. So I think standards will increase. And if the government underwrote an insurance policy that was for the people of the country, it would be easier to control people doing, health service tourism. Because if you don't have the health scheme, you can't come and use the NHS. You'll have to use it privately, and the business they'll be geared for that type of business. I definitely believe, the more I research, the more I feel that this could be a real solution to not only the NHS but also to the education system. If every child had a fixed amount of money given to a school that they attended, the school would be more focused on achieving high quality outcomes to get the best children. The better the school, the more picky they can be. I just think it's worth thinking about. I think sometimes something, just because we've had it for a long time, doesn't mean it's the best way to do things. Let's face it, there's several ways we can reduce the number of visits we do to the doctor every year. We have preventative measures, encouraging people to maintain a healthy lifestyle through regular exercise, healthy eating, avoiding harmful habits like smoking and drinking alcohol excessively. We can prevent the onset, and by doing this, we can prevent the onset of chronic conditions. We can focus on health education. We can start educating, especially our young children and people, on self-care and the early signs and symptoms of illness, to empower people to make informed decisions when seeking medical attention. We can improve access to health information, making reliable health information widely available to help people better understand the conditions and make more informed decisions when seeking medical attention. And most importantly, we can improve the way the NHS runs. We can improve the way the NHS is managed and make it more streamlined to allow more money to go to the services that are desperately needed. Now, the next question is, do you take ownership of your health? Now that we know that it costs so much money to keep our doctors going, some people are going to the doctors on average 7 times a year. And when you look at that and you think to yourself, well, I'm a 40-year-old man. I've probably been to the doctor 3 times in the last 10 years. And you start thinking to yourself, well, what am I doing differently that these other people aren't? And I think it is taking ownership of our health, taking ownership of our mental well-being, and taking ownership of our body. And one of the most important things that I've done in the entire experiment is continuously try to be the best version of myself, and that includes looking after myself and my mental well-being. It is important to look after our health because good health is crucial to both our physical and mental well-being. When we are healthy, we can perform our daily tasks effectively, enjoy our lives to the fullest, pursue our goals and our dreams. On the other hand, when our health is compromised, it can affect every aspect of our lives and limit our ability to do the things we love. Taking care of our health involves engaging in healthy habits such as eating a balanced diet, exercising regularly, getting enough sleep, managing stress, and seeking medical attention when necessary. By prioritizing our health, we can improve our quality of life and avoid many preventable diseases and conditions. And that pretty much brings today's episode to a conclusion. I just want to thank you again for taking the time to watch this video. And secondly, I just want to say there is something about taking the time to start learning the world around you. Now, I started this journey 2 years ago, and only this year have I just really discovered the world of actual research and starting to dive deeper into areas of society that I believe aren't working correctly. The more I do it and the deeper I go, the better I start to feel about how society runs. And the more I start to realize that conspiracy theories often have some truth, but I don't think they're all the truth. And mainstream media and the news and every book we read has some truth, but just not all the truth. And I think it's important when we read stuff, look at the data. Don't look at how things are written. Don't look at how they're trying to sensationalize a specific data set. Write the data out and see what it's telling you. Because when you look at financials, and when you look at the money, or when you look at the numbers don't lie. And it's an incredible way of getting a little bit of clarity into how society is running, and to see how certain things that might be in the media right now have such huge political agendas that they're not actually issues. They're just people trying to get something more out of their lives. They're just a particular section of the country or a particular subsection of people trying to get the most out of what they want. Now, again, they're not bad people. They're just trying to do what's best for them. But they're not always thinking what's best for the country or the people. And it's very hard to be objective all the time, especially when something affects you. And I'll give you a great example of this. Just the other day, my son had a sore in his mouth, and he was like, my tooth's really sore. So we contacted our NHS dentist, and they basically said they didn't have an NHS dentist. So we were like, well, what do we do now? So we started phoning around all the dentists in our area, and none of them had an NHS dentist. And it was going to cost something like £400 for him to get this filling repaired at a private dentist. And I have no problem paying £400 to make sure my son's okay. That is not my point. I have a massive problem paying for a service that I can't access, and then I have to still pay for another service. That is my biggest problem. That is my biggest problem with the NHS right now, is I have to pay extra to access a service that I feel like I'm paying for already. And when you look at the figures of how much money the NHS gets, and you look how much it costs per each person in the country, it's £3,300 and something a year we pay into a system that most of us don't even use a couple of quid of. Yet the system is still not functioning as it should. And it's incredibly frustrating to me. So with everything I do, every time I research something, especially when I research something about the NHS, I'm always looking to see why. Why is it not working way it should? Why can't I just pick up the telephone and make a doctor's appointment? Why can't I access good healthcare? Why can't I access information about certain aspects of health very easily? Why do I have to try and research stuff? Why is it not being taught to me in school? Why is the education system not having, like, we have, physical education? Why are we not talking about health and nutrition and wellness and mental well-being and all these types of things in our schools? Why are we not getting people ready for a life of responsibility by taking responsibility for our own life? And that means taking responsibility for our health. So without me going on anymore, thank you so much for taking the time. Until next time, goodbye.